Well, thank you everybody for being here today. We have two fabulous guest speakers here today, Becky and Eddie with Kern Health Systems, and they will share with us today about enhanced care management that Kern Family Healthcare offers.
All right.
So thank you so much, Eddie and Becky.
Thank you for that.
Thank you.
Introduction. Hi guys, my name's Eddie. So we're gonna go ahead and start. The program is called Enhanced Care Management Program, and it's through Kern Family Healthcare. We're going to go ahead and go over an overview of when it began, the eligibility, the goals, the eligibility, it's a population of focus, the services that we provide, kind of the authorizations, and then also all of our sites that are available throughout Kern County. Okay, so ECM program, it started in January 2022 as a part of the CalAIM, which is the California Advancing and Innovating Medi-Cal initiative developed by the California Department of Healthcare Services. Enhanced care management is a whole person approach that addresses the clinical and non-clinical needs of our members, and then through needs of eligible members through coordination of services. So it's medical, because a lot when we go to a doctor, it's just that we talk to a doctor, it's like, okay, you need to see this specialist, or we're going to refer you out to this clinic. Not only that they're taking care of their medical needs, but they're also just ensuring that everything at home with their social needs are being met, and if not, they can look at that and they're making out those referrals to those agencies, of course, with the approval of the member, and seeing where they want to go and where they want to be at as receiving those services. Okay. The next one is ECM goals, program goals. So improve care coordination. We integrate services, we facilitate community resources, address social determinants, which is the social drivers of health, improve health outcomes, and then decrease inappropriate utilizations and duplication of services, which high utilizers. We want to help those members that are using the emergency or urgent care as their sole PCP. We want them to use their primary care or our ECM provider, our ECM services for their health care and their social needs, okay, services. Same day access is solely with contacting the case manager or a care coordinator, and we'll go over a little bit more of how when a member gets approved for the services and once they get enrolled, the services that they're going to get, they're going to receive. But same day access is that they'll be able to connect with their case manager or their care coordinator, which the case manager sometimes is a nurse that will be able to assist the members in whatever questions that they might be having. Okay. Eligibility. ECM eligibility. Members who will be eligible for ECM services are expected to be among the most vulnerable and highest need Medi-Cal managed care members. Kern Health Systems members are eligible for ECM programs if they fall into the identified population of focus as defined by the California Department of Healthcare Services.
Yeah.
All right.
I'm gonna go ahead and talk about the ECM populations of focus. We have several adults at risk of high utilization, which he already mentioned, people that are using the emergency room or urgent care as their primary care provider instead of accessing or going to their assigned primary care. Next one, and that's if they use, if they've had 5 or more emergency department visits in the past 6 months, or 3 or more unplanned hospital stays. That's the adult at risk of high utilization. Adults with serious mental illness or substance use disorders is another one. At risk of long-term institutionalization, individuals that are at risk of being admitted for long-term care. Adults nursing facility residents who want to move back into the community, and that's another one of our population of focus. Adults in transitioning from incarceration, those adults that have been incarcerated within the last 12 months. Adults experiencing, part of a family experiencing homelessness. Also adults, individuals experiencing homelessness, those that do not have dependent children. Then the birth equity is an adult who and youth experiencing racial and ethnic disparities in health outcomes. So that's one of our newest populations of focus. We wanna make sure we're addressing those people that are experiencing those disparities of health care. Child youth at risk for high utilization is the same as the adult one. They're using the ER as their primary care. Child youth with significant behavioral health needs and or substance abuse disorder. Children within the California Children's Services, they're receiving CCS or whole person care. The whole child model care. Child youth involved in or with history of involvement in child welfare up to age 26 if existing foster care on or after their 18th birthday, which is your population. We want to make sure that they're receiving the care or the services that you need. Okay, we are aware that your children in the welfare system a lot of times have the fee-for-service Medi-Cal. They're not assigned to a managed care provider. Some of them. That's something that they're working on right now to try to fix that problem, because in order to receive that enhanced care management program, they have to be assigned to a managed care plan. Okay. The children who are transitioning from children or youth transitioning from a youth correctional facility within the past 12 months. Child part of a family experiencing homelessness. Individuals experiencing homelessness who are not dependent of an adult and are experiencing homelessness. January 2024, we started the Justice Involved. Kern Health Systems currently accepts adults, youth transitioning out of incarceration into ECM. They're really working hard on having those individuals already hooked up with managed care plan before they are released into the community.
All right. Before we continue with the authorization of ACM services, the population focus is the criteria. So how that's determines if someone is going to be eligible for our program, and it's just how we reviewed and went over. It's a variety of reasons how a member can qualify for the program. But just do you guys have any questions in regarding the criteria?
Because the other slide it said if you have been in child welfare up to the age of 26. Is that just foster care, or does it include like if your mom used like WIC or something?
No.
What is?
I think
it's a foster care.
Okay.
Yes, child welfare system, like the foster care.
Okay.
Yeah.
Yeah. Good question. All right, and then
Authorization for ECM services. KHS identifies eligible members through weekly stratification process, as well as populations of focus are identified through defined Department of Human Services criteria, which is what I just went over. To be eligible for ECM, a member must fall into one of those mandatory population of focus. Members that are identified are eligible for Kern Family ECM program for 12 months, for a year. Okay. After that, they're reviewed and authorized for an additional 6 months each time. Okay. Before the end of the authorization, ECM provider will reevaluate determination, which they were reauthorized for additional 6 months. Sometimes the members are doing well and they don't, they've received all the services and reached all their goals. So the ECM side will let us know if that member is no longer in need of ECM services and they're disenrolled. and their transition to maybe another program if needed. Okay, go ahead.
All right. For referral process, so the members, caregivers, and families can contact Kern Family Healthcare at our 1-800 number to get more information about the enhanced care management. And if they are interested in enrolling, they can just get transferred to our outreach team, and then they can do a self referral if they don't have an authorization. But we're hoping that we have a lot of members that have an authorization for the service, but they don't know because they don't get the letter, or for some reason they overlooked the letter that we mailed out, so they already have it, and we just get them enrolled. We let them know what site that they're assigned to, and then we get them started with the program. Okay. Another way is, of course, is by email. This is also by members, caregivers, families, and even agencies. If you feel that you might have a client or someone that can benefit from our program, you can email us, and then what we do need is just their information, and make sure it's a secure email, and then so that we can follow up with that member. Okay. The partnerships and these resources that we work with within the community. So we work with Kern Family Partners with various community-based organizations to provide our ECM members with needed community resources such as food insecurities, clothing, behavioral health, housing, community resources, and much more. We try to assist as much as we can and connect the members with the resource or the service that they're needing.
I have a question, like for example, let's say food insecurities. What would that practically look like? If they're signed up already with ECM and they have a food insecurity?
So someone that's needing food. So someone that's just that they don't have food. I don't have food for today, or I don't have food for tomorrow. I just need to see if I can get connected with maybe a food basket, or maybe even we'll follow up. And when those questions that we're following up to see if they have CalFresh, if they have any, if they know of any resources. But we do provide our members with a Gleaner's food basket once a month.
Do you guys deliver that, or they have to pick it up?
No, we don't deliver. They they pick up, but we also have transportation.
Oh, okay, so they can utilize the care.
Through Kern Family Healthcare,
okay.
yes.
Okay.
So if we have a member, Becky's calling, hey, and she's enrolled they have to be enrolled in the ECM program. So once they're open, she's calling, and it's like, yeah, sure, let me know how many people in the family. I make sure everything's good, that she is eligible for the food basket, and then I go ahead and place the food basket order for her for that same day. And then if she's like, I got my transportation, okay, great. If she doesn't have transportation, then we'll connect her with our transportation, and then they'll arrange all the pickup and the yes.
Is that the same transportation that you use for the Kern Family Healthcare rides, or is it through ECM and different?
It's the same ECM transfer. I mean, in the Kern Family Healthcare transportation, but with us is because we have different locations for our ECM members. For our specific members for ECM that are enrolled, we offered more locations for them. So Gleaners was part of it.
But the process to get a ride, for example,
It's
to
the
Cleaners is the exact
same calling. Yes.
You would just mention that you're an ECM member, because they do have the list of ECM approved sites. Locations. And Department of Human Services is one of them, the Dream Center, any family resource centers, Social Security Office, Aging and Adult Service. We have a list of approved sites.
So that's great to know. So if you are with ECM, you can get a ride to the Dream Center, for example, because our clients always go to the Dream Center. So that's great to know.
Yes, and you just have to let them know. We just encourage. Let them know you're ECM member.
And if you have any issues with that, sometimes we have had issues where the transportation people say that's not a location, approved location, then ask them to call member services so that they can verify that.
Confirm it. Because we've had that sometimes. They're new with transportation, because transportation, they're not actually with us in our building. They're like contracted.
It's a contract.
That's actually
it's like Lyft, right?
And then another. Well, they have their worker, and then they got Lyft. They got Uber, and then they have other vendors.
We have vendors that are if there's a wheelchair bound person,
if you need special
medical
accommodations
transport as well.
For physical.
You guys should partner with Covenant.
Oh, right here, I know.
Yes.
Yeah.
Besides, and then besides, transportation, helping or taking the members to their doctor's appointments, dental, vision, behavioral health, pharmacy. So yes.
I mean, it would be, if Covenant is interested
As
in
we are a
partnering
family resource.
and partnering with, to be a site, an ECM site, because you do serve the population of,
Just
one
like
of
the train center.
Yes, you serve a population of focus.
That's a great idea. Would help a lot of clients.
I'm saying it's partially selfish.
And you do
Well, but I mean,
provide,
you're speaking for the majority of.
you
the
do
population.
provide, case management, so
Yes, we
that
do.
is what care coordination, case management is what the
Okay. That's
ECM
great
is all
to know.
about.
Yeah. So currently we do have 37 sites, ECM sites throughout Kern County. Okay, we're picking up one more, and we'll go over it the last slide. But these are the sites that we have open and that are providing ECM services for our members. Okay, so we have KM, we have 2 locations. We have Omni. We've got several locations for Omni here in Bakersfield and in Shafter. And then we have Premier. Premier is one of our biggest ECM sites. They have different locations throughout Bakersfield.
Is that a dentist or what's Premier?
Premier is an
Medical.
urgent care
Oh, it's an
facility.
urgent care. Oh, yes. Okay.
And some of our facility or some of our ECM sites do not have a medical provider. Some of them are only case management.
Oh, okay.
Yes. Right, so then we got Clinica Sierra Vista. And then we got Aikido, which Aikido Street Medicine. They usually work with the homeless population. Adventist, Universal MSO, Bakersfield American Indian Health Project, and then Centric. And then also we have Dr. Bashai, Family Health in Delano, Westside in Taft, Libertana, Pathway, and EA Family Services. Independent living systems, and then these are newer ones that we have. We just got Open Door Network, and then we finally Free.
Okay.
And these are the last ones. And the Stay Focused Ministries is one of them too. And then come December, Bakersfield American Indian, but in Lake Isabella. We're hoping that they partner up with us and they get contracted to provide ECM services. Okay. All right. And then just fast track, because usually when we do a presentation, it's for agencies, and it's for
So it is
sometimes for the community members too. But just backtrack and just saying this program is basically case management services for members that are eligible for our program. So it's a free program for our Kern Family Healthcare members. We provide case management. They get an authorization for the program for a year. Once they get that authorization, they're going to get enrolled into one of our ECM sites that you choose, that the member that they want, where they want to go. They usually get assigned to the nearest ECM site for their address. That they go on their address. Yeah. So they that's where they get assigned. But if they're saying, hey, I want to try this one, yeah, we can do a site change. They go to that new clinic. Once they get started with the ECM services, like Becky had mentioned, we have clinics that have a provider, a doctor, a case manager, and a care coordinator. And then other sites that only provide case management. We have members saying, no, we just want case management. We just want to be contacted by phone to help us with our appointments and services. Okay, you know, it's whatever they choose on how the services that's going to work best for them. So we do have those options. And then after they get enrolled, they start the program. They're going to be being called on a monthly basis. It just depends on where they get placed for a tier on the needs, and then they get contacted a little bit more if they're tier 3. But they will get contacted on a monthly basis just to follow up with their medical and their social needs. Okay.
Also, the member can also contact their case manager or care coordinator if they need something. And also if the member is not happy with the site or with the services they're receiving and want to change sites, they are able to do that as long as that site is serving that population of focus.
Yes. And then the great part about the program too is Kern Family Healthcare, we are a reward program.
Oh, yeah.
So the members do get incentives.
They get
for
gift cards,
Gift
right?
cards, yes. They
Mhm.
get gift cards for enrolling and then following up and following through with attending their follow-up appointments with their ECM team.
Mhm.
So at first, when you sign up for the program and you attend their initial appointment, you'll get a $25 gift card for enrollment. So once you get enrolled, you gotta go to your first appointment, and then we're hoping everything goes well and you like the services and that you continue to utilize the service, and then your follow-up appointments, you get a $10 gift card. One per week. You get a gift card one per week. So it's a really good reward program for our members for making that time, meeting with their ECM team and going to their medical appointments.
And Kern Family also has member rewards. These are for all Kern Family
Mhm.
members,
Mhm.
not just DCM. So they have rewards for the members, so that's the one I just gave you.
Yes.
Oh, that's awesome.
Any
Any
questions?
questions or, I mean, I'm gonna leave those there so you can
Okay,
share with
that's
your
nice.
other
Yes.
clients. And if you find that if someone is wanting or interested in ECM, like we said, the information is how to contact us. This is on the flyer as well, the 800 number, or they can call the 632
Mhm.
number, option 4, to get connected with the ECM, or email. They can self-refer by email. And sometimes they may already have an authorization on
And not
file.
know it. Mhm.
Yes, and don't know it. And it's important to make sure that you are updating your phone number, address with Kern Family, as well as with Department of Human Services if it
Mhm.
changes.
Right.
Because the address that we have is coming from the Department of Human Services, and sometimes if they don't change it with them, we won't get
You
that
can't get a hold
information.
of.
Yeah,
So
it just makes it harder for us.
if they do call us, we can change it in our system. However, they have to change it with Department of Human Services to make that change with them. And it's important because they get their packets, the renewal packets, that it's important for them to renew their services.
And then sometimes, you guys can't believe, it's like sometimes we have incentive gift cards that are just there and they're owed and we can't get a hold of our
Yes.
members. It's like, wait, you're going to your appointments, but we don't have your address or a way to reach you, so we can pick them up or we can mail them to your new address, but we have those gift cards sitting there and it's like, hey,
And
give us-
some of our sites, we do have our advocates on site where they can actually give the card to them in person.
Oh, cool.
So there's certain sites that have advocates on site, and they can go ahead and provide them with their gift card when they leave their appointment.
Yeah, you're right.
And
Okay.
one thing that I would like to add, this is more geared towards once you exit THP Plus and once you're 26, that's when you have to start annually renewing your coverage. So are you guys familiar with the website benefitscal.com?
I think so.
That is a great site, even now when you don't have to renew your benefits, that's a great website to sign up with and to already have a registration with. Because that'll show you if your medical is active. I think you probably can also look up your provider. You can see if you're with Kern Family or not, because sometimes we get confused what actually is our coverage or who is our primary provider. It is very, very resourceful, and it specifically becomes important once you're getting ready to turn 26, because you don't want your health insurance to lapse.
Is there an app?
There might be. So
For benefits, Cal, yes.
there's an app. Okay.
Benefitscal.com.
Yeah, you also.
And
I
there's an
believe
app
there's-
too, like if you
I
go on the
believe
app
So, yeah,
system.
because on the phone, yeah.
Okay.
Yeah, that's actually smart. Yeah, to
Mhm.
download the app and just have it on your phone.
And even
And,
signing on with Kern Family Healthcare, there is an incentive. I don't know if are you signed up? Do you have an account with Kern Family? I know you mentioned that you're Kern Family
I think so.
member. Yeah, okay, and they're eligible to get a.
So you have an
incentive
online
for-
portal with Kern Family?
Never tried.
Probably
Okay.
not.
I
No,
know.
if
But
you
then
haven't,
there's an
okay, I would
incentive.
encourage, to look into it and sign in, because you can
Get a
also
gift
do
card.
updates with us too. Like if there's an address or a telephone, you just log into your account at Kern Family and then go ahead and do all the updates.
And
And
even
even
if
request
you
UI.
do, if you do register with, in the portal, you can also get an incentive.
Mhm.
Yes.
Oh,
So
okay,
they do
nice.
offer-
Yeah.
they
Okay,
do
that's
offer
great to
incentive.
know.
Yeah, so-
So-
And then besides all this, I mean, if you do have a chance, because we just come and talk about ECM, but you can always look through our website at Kern Family Healthcare. and you get to see all the services that we offer. We have a health department, health education department that provides a variety of services for our members. Yeah, there's so many programs that we have.
And even the phone number, let's say it's the weekend, you're not sure if you should go to the ER or if you should go to urgent care, the phone number can be extremely
Yes,
helpful
you
in
can call
talking
the
to a
nurse.
nurse. Yep.
Yes, a nurse.
And that might save you a trip, or that might help you figure out, hey, is it, can you go to urgent care, or is the emergency room needed? I feel like that helps, specifically with kids.
Yes.
You know, as a new mom, it can be a little overwhelming sometimes, and
And
even for us
also,
as adults.
If you're not happy with your primary care
Mhm.
provider as well, you know, you can change your primary care provider. It doesn't have to stay the one that was assigned to you.
Mhm.
You have the right to change that provider if you would like.
Mhm.
You mentioned, what's his Jonathan. You mentioned you were having issues with your referrals
Let me
and so
stop.
forth.
Let me stop the recording real quick.
Okay.
Thank you so much.